Booker, what are we talking about today?
Hey y'all, Dr. B with Mint Health. So today I wanted to share a little story about a patient that we admitted overnight. I was working in the hospital over the weekend, a 20-year-old who came in with basically horrible labial cellulitis. So you can imagine that's extremely uncomfortable for IV antibiotics. And the setting of that is that this young lady has had type 2 diabetes since she was 10. And it has been very poorly controlled. And she just really has struggled with how to, change the situation for herself. So I came back into the hospital a little bit ago because I wanted to go back and have a conversation with her and her mom, about really how much agency she felt she had over her life and like what was kind of driving her motivation, because type 2 diabetes really can, for many people, actually even be reversed. And she's so young. And what I read in the notes was that we, the gynecology team, were giving her antibiotics, we're treating her infection, we're making sure that she didn't have sepsis, all these really important things. The medicine doctor consultant, wrote a really nice note about reinitiating her medications, giving her insulin, starting 2 other medications. And really that was it, And so I asked her, what else is it that you think you could be doing? And she said, well, this is really depressing. I really need to keep working with my therapist, and I know I need to carb count. And I was like, is that all that you've really been taught? Or do you think it's just that you need more medicine from, providers and physicians and doctors? And she really didn't know a lot. So we had a big conversation about motivation and where to find those things. But that kind of stirred me to want to express, this major concern that I have, and this really sad situations that I see, especially for such young people, and how they come about, and that we just don't do the best job in medicine at handling those and helping patients to choose the right paths for themselves. So these statistics from the CDC in 2023, the US spent about $4.9 trillion on healthcare. Per the CDC, about 90% of this money is for chronic disease management, much of which is actually preventable. Also, I was listening to Freakonomics, which is a cool podcast, over the weekend. And this Dr. Rochelle Walensky, who was CDC director several years ago, had this really profound statement. We talk about healthcare as if we pay for health. We actually pay for disease. We pay to treat preventable diseases. We do very little to invest as a country in preventive interventions. And I see this all the time, and it makes me so depressed. But then I also choose to practice functional medicine the way that we do, so that I can do what I can as an individual for myself and my family, as well as for the patients that interact with us, to learn how to be different. So I say, just say no to these things. These are all very common situations that we just accept in health: obesity, type 2 diabetes, IBS, acne, depression, anxiety, infertility, PCO, childhood obesity now over 20%, non-alcoholic fatty liver disease, even in young people, which is caused by metabolic dysfunction, autoimmune dementia, arthritis, chronic pain, migraines, fatigue, hypertension, heart disease. Some of these things are going to happen, but the insane amount of them are coming from environmental influences, nutritional influences, lifestyle influences, many of which we can prevent. So in functional medicine, what we ask patients to do and what we try to help motivate and teach and guide is for you to choose your life and how you want your life to progress and how you want to have the energy for the things that you love, which is a big conversation that I had with this young woman today that she really didn't understand and know a lot about, but now she does. I'm going to talk to her again tomorrow before she gets discharged. The journey with functional medicine is all about creating health. It is exactly what the CDC director says we aren't doing. Well, we are doing it. We are doing it in the kind of medicine that we as functional medicine providers practice, and the kinds of commitment and education that we reach out to our patients with. How do you create nutritional health, metabolic health, microbiome health, circadian health, environmental health, hormone health, mitochondrial health, musculoskeletal health? These things really are within people's reach, and so we don't have to all fall to the dungeon of what other medicine do we have. As I always say, I'm so happy we have the extremely advanced medical treatments that we have today, but this is how we circle back to choosing life and choosing health. So I hope that if this rings true with you, you can connect with us at MidHealth. Thanks.